into the post-65 phase and the transition onto Medicare. Now, I'll tell you one thing, Medicare is not simple. And so one of the myths that we've seen that luckily I don't see as often is that, oh, Medicare will cover all my costs. I don't have to worry about health insurance costs once I'm 65. But this is an overview of the four parts of Medicare. Mike, walk us through all of this that's going on here.
Sure. So this is undoubtedly a little bit confusing, but basically, as you look at the left side of these columns, your government insurance that you pay taxes for your entire working life is going to be Part A and Part B. And what that means is Part A is hospital coverage, meaning I think of this more as hotel hospital. It's not the surgeries in the hospital. It's not things like that. It's just basically room and board at the hospital is what you think of this as. And that has a period deductible of $1,632. That basically buys you 60 days in the hospital for room and board. So it's powerful. If you've worked 10 years or 40 quarters, that is no additional premium to you. So that's the good news there. So a lot of people will take that, even if they're still working at 65. It doesn't really hurt you unless you have an HSA account. We'll talk about that a little bit later. But then you have Part B, which is really what I consider the strong arm of your Medicare coverage. And that's going to be all of your medical insurance from the government. So that's partially funded by all of your working years. This year, the base level premium is $174.70. So that's basically uncapped 80/20 co-insurance from the government, meaning that the federal government, Medicare itself, is going to cut a blank check for 80% of all your healthcare needs. As long as it's a qualifying Medicare procedure, tests, surgery, anything you can think of like that. Bad news about that is you're also agreeing to a 20% co-insurance that you would pay, and there is no cap on that with original Medicare. So that by itself, parts A and B, I call that the passport to Medicare. That's the basis of everything, right? So if you're going to use your original Medicare benefits, there is no prescription drug coverage in parts A and B. So you would get a Part D standalone prescription drug plan to cover the cost of your medications. There's various plans available through insurance companies that receive federal dollars, but those are strictly used for prescription drugs that you pick up at the pharmacy. If you're talking about an inpatient or outpatient type of medication that you're receiving, that would actually be covered under Part B. So just remember this, if you remember anything about it at all. Parts A and B are, what everybody starts with, and then you get to make decisions from there. So if you stay in original Medicare, you'll use A, B, and D in conjunction to receive your government benefits, or you can move over to the other side, which you see listed as Part C, and that's what we call Medicare Advantage. So those are the plans that you see advertised heavily on TV right now. We're in the fall enrollment period, and what that really means is you've assigned these three benefits, parts A, B, and D, to a private insurance company that now manages your Medicare benefits. So it becomes an all-in-one type of plan that includes all those benefits inside of it. So you will never have A, B, C, D. You just have A, B, D, or C. So it's pretty cut and dry. I call it the fork in the road decision. Do I want to retain my original Medicare, parts A and B? Or do I want to assign it to a insurance company and go with a Medicare Advantage or Part C plan?
Well, it doesn't sound so simple. Question, I know we're going to talk about enrollment in a minute, but you enroll for each of these things separately, correct? So we think about signing up for Medicare, but really you're signing up for Part A, but doesn't mean you're necessarily signing up for Part B, and then you're signing up for Part D. Those are all separate things, correct?
Correct. Yes. So you have the option, let's say, good example is someone who's going to continue working past 65. Provided they don't wish to make an HSA contribution, you can enroll in Part A strictly by itself. There's no premium to that. You will have a Medicare number issued to you. You won't have the Part B attached to it, but you can opt for that alone and then trigger your Part B when you actually retire. Or you can do it all at once. Part of the application is saying, do you wish to enroll in Part B as well? Let's say you're just going to retire when you're 65 or you're already retired. You're going to want to go ahead and do that. That's going to be the core of your Medicare benefits. You're going to get your card in the mail, the red, white, and blue Medicare card. It'll have a Part A and B effective date on it. And that actually acts as your ability to then choose to enroll in a Part D plan of your choosing, or go ahead and enroll in a Medicare Advantage or Part C plan. So you have to have A and B to get a Part C plan, and you can get a Part D plan even if you technically just have Part A, but there's some nuance there. So just think of that. Yeah, you can enroll in
Yep.
it all separately.
Craziness. I know we're going to talk more about the enrollment process in a few slides, and we'll also talk more about traditional Medicare versus the, Medicare Advantage plans. But Stefan, one of the things that we hear a lot is this concept that, oh, once I'm enrolled in Medicare, I'm covered for long-term care. Tell us how that works.
Yeah, I mean, and that is generally a misconception that I hear in a lot of the conversations that I'm having out there, is that Medicare covers long-term care, and that's unfortunately it's not the case 100%. You think of Medicare as an extension of the health insurance that you have during your working years, and health insurance just basically does not cover long-term care services, right? That's going to cover you for illnesses and injuries, but not for any care that may be required after that. Right, so any care that you would be required, in some instances, Medicare may cover up to the first 100 days. And in those instances, typically the first 20 days are covered if you're discharged directly from a hospital, directly to a facility. And then for the remaining days from day 21 to 100, there's a significant copay. And currently in 2024, that copay is $204 a day. So even with Medicare, you're still potentially paying up to $6,000 plus per month if you are discharged from a hospital to a nursing facility after 20 days. So, and then after 100 days, right, you're on your own at that point in time. So really, we're out there trying to educate people about these kind of the ins and outs of how Medicare works. I know Mike's having these conversations and everyone else as well to say, listen, this is something that needs to be addressed, because if you think that it's going to be covering it, not necessarily that it will. And at the levels that it does, you're going to be there for an extended period of time, right? It's going to be woefully inadequate for that coverage there.
Yeah, it's really good to know because, occasionally we do still see people that think, oh, it's okay if I need a long-term care facility or assisted living or a rehab facility, like that's covered. And no, that's not necessarily the case.
Yeah, and I think the second part of that too, right there, is that for the people that are going directly from a hospital to a nursing facility, right, your choice of care environment is not necessarily yours at that point in time. So you have to be mindful that if there's a situation where you may end up needing care, do you want that to be your choice or the state's choice?
Yes. There's one more part that I'd throw in there too, is that what Stefan is talking about is skilled nursing. So there's requirements to even get there to begin with Medicare. So you have to be in the hospital for 3 days, 72 hours, and then you're discharged to a skilled nursing facility. But even though, just like Stefan said, it's extremely accurate, you get 100 days, but you don't necessarily get 100 days, because what can happen is if something has happened to you where you enter the skilled nursing facility and you're not showing signs of improvement, they're going to discharge you. And at that point, you do need to look into true long-term care planning, or, the coverage that you have in place is going to be what you lean on. So just because there are 100 days involved does not mean that you truly get those 100 days. So you want to be careful of that. Stefan's 100% correct on that.
Thanks,
Yeah.
Mike.
Yeah, and we'll be talking more about ways to plan for and cover those costs. Right now, looking specifically at Medicare enrollment, one of the common questions we get when people turn 65 is, do I have to roll? Do I have to roll? Do I have to enroll? And the answer, of course, is it depends. Mike, walk us through this.
Sure. So unfortunately, this is not a one size fits all, type of guidance here, but there are things that I listen to when I sit down with people. And just like Dana said, there is a big misconception that once you turn 65, you have to enroll in something. And I get that a lot of times when I'm on calls with people who want to know, well, I have to sign up for something, right? And the answer is not necessarily. You may not have to enroll in any part of Medicare, it just depends. So the one exception to that is if you're covered by a large group health plan, which is defined as 20 or more employees, you can forego enrolling in Part A and Part B. You don't need Part D or Part C or anything. You can just continue to use the same group insurance that you have as long as you are actively employed in that position at the company. The other nuance to that is if you have a spouse that's covered by that plan that's tied to your active employment, you can also delay enrolling in Medicare Parts A, B, etc. So that's one of those things. So long story short, you may not have to enroll into anything. You don't need to inform Medicare that you are choosing not to enroll in anything. It's kind of on you to make sure that those qualifications are met, and then you can forgo that. A lot of times people may sign up for Part A even if they have that. One of the things that I do want to talk about, Dana and I were kind of talking about this yesterday, is let's say you are working at a company that has less than 20 full-time employees. That is what they consider non-creditable coverage, meaning that you cannot delay Parts B or Part A for that. So you want to go ahead and take both in that situation, because fundamentally, if you're on that group plan after 65, the group plan acts as a secondary insurance. So if you don't have Parts A and B to act as the primary, you are now the primary insurance. The group plan is secondary. So you can be saddled with some pretty uncomfortable bills if you're not looking out for that. I usually advise everybody two things that you can look at to kind of tell whether those criteria are being met. One is you will get a creditable coverage letter every year saying that your coverage qualifies you to specifically delay your enrollment in the prescription drug part. And then you can go ask your HR at your employer whether the coverage that you have qualifies you to delay Medicare. So that's how that works there.
I want to bring up a story you and I were talking about related to that. So it was a horror story that we heard, and I think the person telling the story was actually working with a Wall Street Journal investigative reporter. The story was supposed to come out last weekend. I didn't check to see if it did, but it was a case where someone did ask their employer, but it was a less than 20 employee employer, and they were like, "Oh no, you're on our insurance. You don't need to enroll in Medicare." And so they didn't, and they got diagnosed with cancer, a stage 4 cancer. Ended up, 8 months later, not realizing that, they weren't covered in any way, shape, or form. They hadn't enrolled in Medicare, and their coverage through their employer was denying all the claims. So it was, like $1 million of bills at this point coming in. And so we've always told people too to talk to HR, but it made me realize, if you're working with a large company, that's probably okay. But if you're with a smaller company, a lot of times they don't have an HR specialist or benefit specialist, and it's possible they may not have the best information. And so we all have to take self-responsibility and really double check. That's what I kind of came away with. Would you agree with that?
No, absolutely. And if you really want to be thorough, you can actually call the insurance company that you're with through an employer, and they can provide you that information as well directly, just to confirm what the HR department is saying. So a lot of times I'll see, there's some companies that are very large that I'm shocked if it's not creditable coverage. But again, if you start looking at maybe there's 10 to even low 20s in the number of employees at a company, you definitely want to make sure you're not falling into that boat, because there's calculations for part-time employees. It's not always cut and dry. So what Dana said is accurate. Just really triple check, make sure you're getting all the information, because that can happen. I've seen that happen, unfortunately, for some folks too. So you don't want to find yourself in that boat.
Yeah, and there was a couple other things I heard. One was a case where somebody was, they and their spouse, as you mentioned, were on their employer coverage. But it was a smaller employer. The spouse turned 65, and so they didn't realize that coverage would no longer be primary. And again, it was one of those just cases where, they get medical bills, the claims start to get denied. They just didn't know. And, the working spouse was not yet 65. So it kind of just didn't come up to the top of their mind to say, oh, we're still on your employer coverage. But Those are some specific cases to watch out for, to help your family and friends watch out for that. If you have anyone turning 65, regardless of their coverage, they really want to take a fresh look at it and make sure they're enrolled in what they're supposed to be enrolled in.
Yep. And the other one that I see that's come up a few times is, let's say that you are offered an exit package from a company where they say, we'll keep you on the insurance for the next 2, 3, 4 years, something like that. And we're just going to pay for it at 100%. Sounds like an excellent deal. But again, if it's not active employment, that's still, even though the coverage is creditable, you are not meeting the definition of active employment to qualify you to delay Medicare. At that point, if you have a younger spouse that's not yet 65, you can ride that out. That's a great benefit. But if somebody is 65 or older and you get that news, you do want to transition to Medicare coverage to avoid any problems.
Yeah, now in that situation, you could sign up for Part A and B, and then the employer coverage could essentially serve as that supplemental plan.
It could, yep. And then you would just make sure that the drug coverage is credible inside of it. That's when you really want to do some analysis too, because generally the out-of-pockets on the employer plans are a little bit higher than potentially a Medicare supplement. So you really have to look at the efficiency of how the plan is now coming together and the coordination of benefits between Medicare itself and the group plan. So again, not a one-size-fits-all situation, but the devil is always in the details. We just have to kind of take a look and know what we know and help somebody through that.
Yeah, and so that would really mean if you're offered a retiree medical or COBRA or an exit package, it doesn't mean and you're about to turn 65 or over 65. It's not an automatic, yes, that's what I'll do. You really need to examine your options.
Yes, absolutely.
Yep.
And then I think you're going to talk about it too, but the COBRA coverage, you definitely, if you're over 65 and somehow you're still being offered that is not creditable coverage. You need to take Medicare for that to work.
Yeah, that was another horror story I heard at a conference last week was, someone who was like, I'm covered, I'm on COBRA, but they were, had turned 65 while on COBRA. And again, they didn't know that they needed to enroll in Medicare. And you would need to enroll in that case in Part A and B?
Yes, because Medicare is going to be primary. Another kind of cautionary tale about that piece there is if you have the COBRA and let's say it's either heavily subsidized or you've been given some sort of benefit to pay for it, I do run across that as well. That COBRA coverage has an 18-month limit on it. So a lot of times if there is a health condition that somebody has, you could run into a situation where after you've basically triggered your Part B and you've been on Medicare for longer than 6 months, you now have to get health questions be asked of you to obtain a Medicare supplement. And that can get a little bit convoluted there in how somebody can transition into other coverage. So you definitely want to evaluate that. That's definitely a look before you leave situation.
Got it. And there's also penalties. So if you were supposed to enroll in Parts A, B, or D, but didn't and then sign up late, you can be assessed. Is it a permanent lifetime penalty?
It is a permanent lifetime penalty. It's 10% per year of the premium. So that penalty actually grows over the years as the Medicare Part B premium grows. That premium, that's going to stick with you for life, unfortunately, if you're assessed that. Part A, most people qualify for that premium free. So again, that's always the concern. Well, I at least have to sign up for Part A. Well, as long as it's zero premium, even if you delay it, 0 times any number is still 0, so there's no penalty there. There is, sometimes you'll run across people that have to pay for Part A because they don't have enough working credits. The way that works is if you delay Part A when you should have had it, and this is for the people that have to pay for it, the penalty only lasts for as long as you should have had it. So if you went 2 years without it, it'll fall off after 2 years. Still very uncomfortable. Those premiums are large, so you just want to make sure that you cover all your bases. The Part D penalty, that, not to make this any more difficult than it already is, but it's 1% per month times the national average prescription drug cost. So right now that's in the $30 range. So every month, if you go 2 years, it's 24% of that number is what you would pay in a penalty. And that is a lifetime penalty for sure.
Wow. Wow. So you definitely need to be paying attention and sign up when you're supposed to sign up. Now, I know if you are with an employer over 20 employees, um, we talked about you can enroll in Part A, it's premium free, but some reasons you would not would be if you were funding a health savings account. So if you delayed the enrollment of Part A and B because you had creditable coverage, then you could continue to fund an HSA account. Um, Other than that, if you didn't have an HSA, is there any reason why you just wouldn't enroll in Part A when you turn 65?
No, it doesn't hurt you to not do it, but there's no reason if you're not going to make those HSA contributions to not take it. It's just then it makes it a little bit easier to sign on later, and only slightly easier because now you have a Medicare number. You just have to activate your Part B coverage. So that's the thing. Only thing to look out there is if you work past 65 without taking Part A, when you actually apply for Medicare Part A and B, they will backdate your Part A coverage 6 months from the time of application. So there could be an overlap with an HSA contribution that could create a little bit of a tax liability that could be cleaned up, but it's unpleasant for sure. So you just want to be aware of when you're doing that, really have your dates lined up for when you need to stop making those contributions if you're doing that.
Yeah, and as a practical example on that, let's say you work till 68, and you were going to enroll in Medicare on your 68th birthday. So they would backdate your Medicare 6 months. You could still do half a year's contribution to that HSA, assuming it was your birthday fell so that it was exactly half a year. So you can prorate those HSA contributions the year that you enroll in Medicare.
Absolutely. You just want to be careful there's no overlap. And other than that, you're absolutely fine to do it.
Yep. Now, to complicate things even more are these Medicare enrollment months. And so here we have age 65, and you have this window of time. So generally it's 3 months before you turn 65 and 3 months after when you can enroll. If you enroll in the 3 months before, you follow these gray bars and coverage will start the month you turn 65. If you enroll at 65 or later, generally coverage will start on these bottom gray bars the month after. Now, there's this special rule if your birthday occurs on the first of the month, where you get an extra month where you can enroll, and now your coverage would start the month before age 65. This is craziness, right?
That is correct. I still am not entirely sure why that is the way it is, but it is accurate. So basically, if you're somebody who's lucky enough to be born on the first of a month, your coverage is going to start the previous month. So just think of it, that 3-month window shifts over 1 month for you. So so if you were a January 1st birthday, your Medicare actually would start the previous year for December, just to kind of frame that, how that works. But yeah, generally 3 months before, and what you're saying is true, that's always just based on the first. So it's the first of a month. So if you're 3 months away, your Medicare actually starts on the first of the month that you were born, unless you're born on the first, but let's say you're born on the second or later, always the first, and that 3-month period starts on the first of whatever month is 3 months preceding your birth month. And that always starts your birth month of 65. And then, it just every month after that, let's say you wait until the 15th of December because that's your birthday. January is the month it's going to start, and then it just rolls over month after month.
Now, you and I talked yesterday about some problems that we're seeing because I mentioned peak 65, more people turning 65, and thus more people enrolling in Medicare. I don't know how well the administration is staffed for this volume of people. And so you said you're not really seeing problems for the people that apply before 65, but for the people who may have had creditable coverage or they're applying after 65, there's been this delay in processing. So even though you may apply on time, they're not processing the application on time, which could leave you a gap in coverage. Have you seen some of this?
I have a little bit, and then at best case scenario, sometimes if it's heavily delayed, somebody just kind of knows they have Medicare, but they don't have a number, and they kind of push it back to, when the application was supposed to have been processed. But it's very challenging if you have any sort of medical issues that come up in that period, and it's not very comforting. So I always tell everybody, whether you're turning 65, retiring, start as early as you can, because it is the government, it's paperwork, things happen. Just give yourself as much of a fighting chance to be done in a timely fashion. We don't want to wait until, April 15th always to start doing our taxes. Same idea here. Earlier is better. And then, but yeah, for the most part, if you're turning 65, it's been pretty quick. In the fall season here, as Medicare is processing more information, it can be delayed a little bit. So yeah, again, just early is my advice.
Yeah, and we've heard, best practices, even if there's going to be an overlap with your current coverage, it would be better to make sure you're enrolled and have a month or two of overlap than take that risk that there's going to be a processing delay. And now you're going to have to fight the insurance company to get things
Yep.
backdated. And yeah,
It can be
nobody
very
can go
difficult.
through that.
Yeah.
Yeah. Now, we talked about HSAs, and I think we really covered this, but if you have creditable coverage, then you would forego all parts of Medicare to continue to make your HSA contributions. Now, some things about automatic enrollment. If you're taking Social Security, you will be automatically signed up for Part A when you turn 65. You really have no choice. It's just boom, automatic. I don't know that you can even go in and turn it off. Do you know that?
Yes, you're actually, if you're drawing Social Security benefits, let's say you're a non-working spouse, that's where I see this happen a lot. You're a non-working spouse that's actually drawing Social Security benefits 4 months prior to your 65th birthday. You're actually enrolled in Medicare A and B automatically. You're just going to get your Medicare card, and it tends to come right before that third month of your window. So if that's the case and you're drawing, you actually can turn off your Part B. You have to have Part A to keep your Social Security going. But if you have other, an offer of employment coverage or something like that, you can absolutely turn off your Part B. So you don't need to take it. Quick way to do that is you sign the card, you flip it over, you send it back. They'll send you a card with just Part A on it. So don't miss out if that's your situation.
Interesting. I've also heard of a case where, like you described, the one spouse was not working but was receiving Social Security, automatically got his or her Medicare card at 65. And so when the other spouse turned 65, they were waiting and their card never showed up. So they thought it was automatic. And again, they missed their enrollment date just because, that's how it worked for their spouse. They just thought at 65, they send you this. Hey, I don't have to do anything, not realizing that they were not claiming Social Security yet. And so they had to actually go and you enroll through the Social Security Administration. And so they actually had to go to the SSA.gov site and then enroll in Medicare, set up an appointment, or I believe you can do it online. Is that true?
Yes, both ways. Online is pretty quick these days. That's generally what they would like you to do, less processing. But yeah, you do have to manually do it.
We talked a little bit about this Medigap versus Advantage. Tell us a little bit about the differences and some of the pros and cons of each.
Sure. So I just call this decision the fork in the road Medicare path that you're going to take. You're either going to go with basically retaining your original Medicare, which we can call the Medigap route, or you're going to go with an Advantage plan, which is the Part C route, right? So on the Medigap side, big pro of that is when you have your original Medicare benefits, you can use any doctor, any hospital, anywhere in the country that takes Medicare. That's the network. So in a sense, it's just Medicare is your network. Whoever takes it anywhere, you can go there. There is no prior authorization with that. You can just go in. If your doctor orders a procedure or a test or something, it'll flow through Medicare, no questions asked. So you have a high level of freedom of choice on that side. Very wonderful and very low out of pockets when you pair it with a Medigap plan. So essentially your annual bills this year could be at most $240 for approved Medicare procedures. So very helpful there. The big con of it is unfortunately to have the Medigap plan, or the Medicare supplement is also what it's called, and a standalone prescription drug plan. There may be additional premium that needs to be paid. So on a monthly basis, it may be slightly more expensive. That's the only con of that side. And then on the other side with the Advantage plan, the big pro of that is it's a lot of $0 type plans. So there may be a small premium or no premium depending on where you live and what plan you want to choose, but it can be a low cost monthly number. The big cons to that a little bit is you are dealing with managed care. So it's an HMO or a PPO type plan. So there's some network restrictions, things like that. There's co-pays, there's co-insurance, there's out-of-pocket costs that you would only pay as you use the plan. So in a bad year, you could face a higher utilization cost that affects your bottom line a little bit there. And then again, you're just dealing with network coverage. I tell everybody there is no right or wrong to that. It's an individual choice, whatever you find value in, but that really is how it is laid out there.
Yeah. And I would agree there's no right or wrong. However, from a risk standpoint, from a financial risk standpoint, we typically tell people, look, if you can cover the premiums, we know we're going to be able to cap your costs. So in a worst case scenario, you're going to have much more financial protection over here with a Medigap plan. And that's what we really want to watch out for in retirement, are these big risks that could derail your plan. And so we view the Medigap from a risk management perspective as the safer choice. Would you agree with that?
I would say, yeah, it certainly lowers the costs. So it makes it very known, you know what your premiums are. It's a little bit more predictable, things like that. And just you might have a somewhat easier time using it again because of the non-network restrictions and things like that. So I tell everybody, if you like the idea of that freedom and you don't mind paying a little bit of an additional premium, not a bad way to start, just because it's a lot easier to move from a Medigap plan to an Advantage plan in the future than start with an Advantage plan and go to Medigap, because a lot of times you can always return to original Medicare, but those Medicare supplements or the Medigap plans require health questions be asked if you've been on a Medicare Advantage plan longer than a year. And that can be problematic if you wanted to make the switch and maybe you've had a couple of unfortunate episodes with some changes in health. You can actually be excluded from having the policy, or the policy could be rated to a higher rate. So, just food for thought there, but never a question with Advantage plans. There's no health questions for those. You can go over there anytime.
So just to make that clear, if you're here in an Advantage plan and you were to have some health issues, essentially underwriting could be required for you to move back over here. So you could be permanently here on an Advantage plan simply because you no longer qualify to get the Medigap. Is that correct?
Well, it would be the more efficient way. You're never required to stick with the Advantage plan, but your option would be, again, if you can't qualify for the supplement, you would just return to original Medicare, and that would create that risk of an uncapped exposure for you. So that could be catastrophic to your financial plan. So I always recommend, you want to either have an Advantage plan or a Medigap plan or something to contain the cost.
Yeah. Now, speaking of containing costs, this was some data we found on T. Rowe Price that was also current 2024 numbers, and they were just framing things in terms of low, medium, high, very high costs, really related to, costs could come from risk factors, things like hypertension, diabetes, asthma, depression, cancer, heart disease, things that might put people in this very high cost category. And so here they were talking about, someone that had Medicare only, A, B, and D, Medicare Advantage plan, or Medicare with the Medigap policy, also called Medicare supplement. So you'll hear the term Medigap, Medicare supplement. And so here they were just framing the actual cost, out-of-pocket costs you might experience. This didn't include costs for dental, vision, hearing. It was really, things like deductibles and co-pays. And so, here we see, in this case, the Advantage plan had a lower estimated out-of-pocket cost. However, I believe in certain scenarios, like you said, Mike, these plans could actually result in higher costs than one of these other choices. it just, not probably than just basic Medicare, but you could see an Advantage plan in cases that resulted in higher costs than the Medigap. Is that correct?
Yes, if you have a bad year on an Advantage plan, potentially just because of how the standardized Medigap plans work, you would have a higher out-of-pocket cost as you see doctors and do procedures and get treatment for sure. That is a thing. And then, like you said, the Medigap plan, it does limit that to a very manageable level. You just have that additional premium. But, you can see Medicare by itself with nothing behind it has a higher cost even in this example. So I don't.
Yeah, and we're going to look at an even worse example. But just kind of sticking with this, so I think of it in terms of my primary goal was to manage and have the lowest monthly costs. The Advantage plan might accomplish that for me, but I am retaining some of the risk that I could have a year with really high costs versus if I was willing to pay a little bit more on a monthly basis, I'm now capping my worst case risk.
Yes, 100%. Yeah, you're giving
Yeah.
yourself a little bit more exposure on that side for sure.
Yeah. Now, I mentioned we'd talk about a worst case scenario. So this was a sample of, again, somebody with low versus high costs, but they had a Medicare supplement policy versus someone with no Medicare supplement policy who incurred a $100,000 event where they would have to pay $20,000 of that cost out of pocket. And so here we're seeing this first kind of orange bar is the estimates for premiums for Part B and D. And then the lighter peach colored bar is estimates on an annual basis of the cost of the Medigap or Medicare supplement policy. Then we had out-of-pocket estimates for dental, vision, and hearing. And then here was the out-of-pocket medical, deductible, and copays. And so as we were planning for this webinar, our conclusion was don't go naked. So don't go without some kind of a Medigap or Advantage plan that helps contain these potential costs if you were to have a heart attack or a stroke or an injury, an accident, a ski. I don't know if you're still skiing or, but you could be stepping off the curb and have some strange accident that ends up being an expensive event. So don't go without coverage.
Absolutely.
One of the last things we wanted to talk about in this section were just the IRMA premiums. So IRMA stands for the Income Related Monthly Adjustment Amount. And if your modified adjusted gross income, and of course there's a different definition of modified adjusted gross income here than in our previous definition, but if it exceeds these levels, then you will pay more for your Part B and D premium. So it's just something to be aware of. Sometimes there's ways to plan your income to keep you under the next threshold. Sometimes you can ask for a reconsideration. So these premiums are determined by looking at your tax return 2 years prior. And if you were to stop working and they're looking at your tax return 2 years prior when you were working, you can file and basically say, there's one of 7 reasons to request a redetermination. And so that can be something to consider. Roth conversions can put you over these limits. It doesn't mean you shouldn't do them, but it means these need to be factored into the analysis. So just something to be aware of as you're doing your planning that you could be subject to these IRMA premiums. And one other thing related to costs. So we talk about healthcare costs and the concern that they're going to be just exuberant in retirement. This is a chart of nominal costs. So these aren't inflation adjusted, but basically starting around 60 to 64 all the way through age 95. And this green bar is healthcare costs. And so we do see healthcare costs rising throughout retirement, but you have other costs up here that are declining. Transportation, because typically you're not traveling or as much, then you have travel costs. You can see that those get smaller. You have entertainment costs, apparel and services. Those tend to get smaller. So in terms of, total cost, we do see spending decline as people move through retirement. Healthcare takes up a larger portion of those costs, but it's often a substitution for entertainment and travel and other things. Now, when I say decline, when I look at this graph, it's in nominal dollars, which means if we were to put it in what are called real dollars that are actually adjusted for inflation, it would still be a rising line. It just means your costs are still going to go up, but not as fast as inflation. So that's what we typically see in retirement. And people in inflation adjusted terms tend to spend less in these slow go years. Still related to cost, when we plan this out for people as part of their financial plan, we create a timeline. So here was a sample of Sam and Sally on a healthcare.gov plan, unsubsidized, each paying $1,000 a month in premium. They were age 62 and 63, and we can see we expected those premiums to go up with inflation. Typically, we are using a 5% annual increase when we do this kind of modeling. And then what happens here is Sally turns 65. And so she transitions onto Medicare. And so we add in a Medicare supplement policy and her Medicare Part B premiums. Her out-of-pocket costs, we still estimate probably on the high side, but we're including costs for dental and vision and hearing. And so you can see her total cost actually went down when she went on Medicare. And then we see the same thing up here for Sam. So Sam turns 65, in this case, toward the end of 2027. So he's 66 in 2028 and, turns 65 in 2028. And so we see as he transitions onto Medicare, his total costs went down. And that's very common. Mike, I think you and I were talking about this, and you see, universally, as people transition onto Medicare, their total costs are usually less than they were the year before.
Yeah, absent any extreme subsidies in the marketplace or something like that, the premiums generally go down. The out-of-pocket certainly can be a lot lower, so that is accurate.
Yep.